The development of this podcast was sponsored by Alexion Pharmaceuticals Incorporated. The viewpoints expressed are those of the person speaking and not of Alexion. Welcome to NMOSD Your Way Global, an educational podcast series for NMOSD patients worldwide. NMOSD stands for Neuromyelitis Optica Spectrum Disorder, a rare relapsing autoimmune disorder of the central nervous system which primarily affects the optic nerves and the spinal cord. Your podcast hosts Lalania Lloyd and Debbie Latique, who have both lived with NMOSD for over 10 years, will be bringing their respective Canadian and Australian perspectives to the table in order to help patients worldwide better understand NMOSD. Over the next 16 episodes, clinicians, researchers, and fellow patients will come together to have important conversations about how to live your best life within your diagnosis. They will be offering up encouragement and practical tips for overall health and well-being. In this episode, Debbie talks with psychologist Sally Shaw to share insights about how to manage uncertainty when dealing with NMOSD. So, let's get started.
Hello and welcome, Sally. It's wonderful to have you on the couch today. I first met you as a patient with NMOSD about 9 years ago, and then again hosting the first NMOSD conference in Melbourne, and you were invited as a guest speaker. Your work as a psychologist and as someone who really understands the challenges of living with a chronic autoimmune condition has certainly helped me personally in finding purpose and fulfillment, as you know, despite having a diagnosis of NMOSD. There are quite a lot of similarities, aren't there, Sally, with MS and NMOSD, with one being the uncertainty of when you may relapse, and particularly for NMO, what the long-term outcome of the relapse might be. That can be pretty stressful, can't it, for people? What advice can you give to someone who might be living with that worry or fear?
Yeah, hi Deb. Thank you so much for having me today. I'm so thrilled to be here. And you are absolutely right. Don't you reckon you have nailed it with the whole idea of the uncertainty being the big thing to get your head around when you are diagnosed with something like NMOSD. I think there is so much to take on at that time of diagnosis, like so much. You are all of a sudden in a health setting. You are all of a sudden accessing these services. You are being told about a diagnosis that you are being given, and you may have never heard of this diagnosis before. I mean, I guess we should start, really, Deb, by saying how unique this experience is to every individual. There are so many different stories that go alongside a diagnosis of NMOSD. And for some people, I mean, you know, we can find this strange, but for some people, the diagnosis is an absolute relief because they've had weird and wonderful and not so wonderful things happening to their body and they have no idea what's going on. And all of a sudden they're given a label, they're given a diagnosis. And for some people, it can actually be a bit of a blessing that they can say, okay, now I know what's going on. Now I can move from this point. But for others, certainly, does not feel like a blessing at all. It can be something that is tremendously challenging, really frustrating, difficult, emotion-packed, and the uncertainty can take a huge part of that for them. So it can be tremendously challenging, Deb, because the uncertainty is one of the biggest things that occupies our headspace at the time of diagnosis. We don't know what this will mean for us next week or next month or next year or 20 years from now. And sometimes we can go with those thoughts. Sometimes our guard comes down a little bit, and as much as we're telling ourselves that this will be fine and I can do this, sometimes we think maybe I won't be fine, maybe I can't do this. And the catastrophic thinking can really leave us spiraling out of control sometimes. So I think you asked about advice around that uncertainty, and I think the biggest piece of advice, although of course, as a psychologist, I should never give advice. But the biggest piece of advice I would give is to take a breath and to realize that you don't know what you don't know. And that first 12 months after a diagnosis of NMOSD or MS or any chronic health condition is tough because you're getting to know the impact of it in your life and your response to it in your life. And it takes a good 12 months. I will often say to people, you know, if you are waking up and you're thinking about NMO every day for the first 12 months, that is not abnormal. It's normal. It's a part of this. It's a part of working through it and processing it.
Thanks, Sally. Yeah, that is so true. I remember that first year. It's really a day-by-day thing, and it's learning to live in limbo, because up until then you're used to having a life that's predictable.
Yes.
And you know, for me, I planned everything ahead, and then so living with that unpredictability was something that you helped me come to terms with.
Oh, great.
I know personally that it can be really difficult to think positively as well when you may be in pain or have those lingering health issues from a relapse. What do you suggest for someone who is really struggling?
Great question. The first thing I don't suggest is to think positive. And I think a lot of people fall for that, don't they? The people around us, our friends and our family members, the people that love us, they can fall into the trap of telling us, think positively, think on the bright side. You know, it wasn't a life sentence. It's not cancer. They try and say all these things to make us feel better. It doesn't often make us feel better. So thinking positively is not a strategy. It's not a sound psychological resource when we're trying to get through something as difficult as residual symptoms from a relapse, or pain that can be lingering, or anything that can be lingering from a relapse or from your condition. So I certainly don't aim for negativity, of course, but I aim for something, a nice healthy bit in the middle, which I call optimistic realism. I am all about keeping it real. And something that's really important about keeping it real with a chronic health condition is recognizing that it can be a struggle, recognizing that you can experience not only symptoms that are painful or make functioning difficult, but that you experience the emotions that go alongside. So it's important for us not to pretend that we're not going to have bad days. It's important for us to try to find a place where we can, dare I say, acknowledge the uncomfortable and acknowledge that we will have bad days, and that that is part of living with a chronic health condition such as NMOSD.
Yeah, Sally, that's interesting you say about, it's very hard to be positive, and the people around you are trying very hard to lift you up. And I like to keep it real as well.
Yes.
And it's the people around you that sometimes struggle with that and find that difficult as well, because it's all new to them as well.
That's right. That's such a good point. And they're going through something as well. I mean, I hate to use the word journey because that's a word that all psychologists, have to use, or we lose the title. But it's the journey. You're on a journey. Your loved ones are also on a journey. They don't have NMOSD in their body, but their life now is going to be affected by this disease. It just happens to be affected in a different way. So sometimes they do fall into the trap of trying to either fix it for us or tell us that we need to, look on the bright side or to be positive. And that can be really difficult to manage.
I can imagine that for some people living with NMOSD, they have to make adjustments to their lives, maybe giving up work, as in my case, or just not socialising as much. How does that change impact a person? What can be done to help and support someone going through that?
Yeah, the change can be such a great impact. And I think when we look at it in terms of somebody's life changing and them then having to cope with those changes and manage that adjustment, we need to look at who that person perceived themselves to be pre-diagnosis and who they now perceive themselves to be post-diagnosis. And it's important not to shy away from those hard conversations. So often is the case, so we'll be a bit stereotypical here, often the person before NMOSD is somebody who is achievement focused. They like having a plan. You said that before. They like having a plan. They like being in control. They like knowing what's coming up. And They are employed, they have particular relationships, they might be socially active, there might be a whole range of factors that they identify as having and being that person. And then a diagnosis such as NMOSD really turns everything upside down, and you can land with a bit of a thud and realize that you are still identifying as somebody that you no longer have the capacity to be able to be. Now, that doesn't necessarily mean that at the time of diagnosis your life is over, and obviously far from that, I believe far from that. But it certainly means that life changes. It might change in a little way. It might change in a number of dramatic ways, but it's very important for us to not lose sight of who we are as individuals and to have a bit of a handle on our sense of self and our self-identity. And a lot of that is tied up in really a grief response, Deb, don't you think?
Yes, absolutely. I was going to mention the word grief.
Yes, because we grieve who we thought we were. And I don't say we grieve who we were. I really say with intent and purpose, we grieve who we thought we were, because who we think we are is really just an illusion that we're managing to uphold day by day. And you talk to anybody who has had a sudden crisis in their life, whether it be health related or the death of somebody close to them or a very quick change in their financial situation. You know, you talk to anybody who has had an unexpected crisis and they will tell you that they thought they were somebody until they were faced with this challenge, and then they realised that that whole person that they believed themselves to be was actually a bit of an illusion. They were lucky to live that life for a while, but things can change dramatically and can change very, very quickly. So a lot of this is about recognising a grief response. A lot of it is about self-compassion, and I think we will probably end up talking a bit about self-compassion today. But a lot of it is about being able to be kind, I guess that's self-compassion, and to recognise that it is a process. You don't get given a diagnosis such as this and then, you know, get to the acceptance point tomorrow. It just doesn't work that way. We have to be kind to ourselves.
Exactly. And it also takes a while physically and mentally to establish where you're at and where you're at in the disease, both mind and body.
Yes.
And so that side of it is also letting go of that grieving. The identity part of it is you think you're tied up in your career, but it's actually another opportunity. I think for me personally, it was an opportunity to find out who I really was, apart from being a teacher or a career person.
Yes, because you are so much more than your job description, or you're so much more than the relationship. You're not a wife. You're not just a wife. You're not just a parent. You're not just a teacher. You're not just a marketing exec. You know, you are so much more than the labels that we put on ourselves. You are not just somebody who lives with NMOSD. You know, none of it. And sometimes I think people fall for, well, now I'm not a teacher. Now I'm only a person with disability. I say in inverted commas. And I think, oh my goodness, you know, we really need to do a bit of a deep dive if people view themselves so one-dimensionally. Yeah.
Absolutely.
Yeah.
Thanks, Sally. I often hear about focusing on what you can control, and I can relate so much to this as well. Can you unpack that a bit for me and why it matters?
Yes. I really do love it, but I think it's a saying that is thrown around a bit now. So maybe we just say, oh, you've just got to focus on what you control, blah, 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 you know, and we all move on. But I do think it's a really worthy statement for all of us to sit with and say, okay, what does that actually mean? And to go back a step, I think it's important for us to split ourselves or our human experience into three components: thoughts, feelings or emotions, which of course are, as you know, determined by your brain and your thoughts, because we don't actually have thoughts and emotions from our heart, even though we kind of touch ourselves, you know, here, you know, on our heart to say this is where the emotional center is. No, they're all just, you know, our thoughts as well. But we split it into thoughts, emotions and behaviors. And, you know, as a psychologist, it's a big part of my job to help people examine their thoughts and to see which thoughts are helpful, which thoughts are not helpful. But it's also important for me to validate for people and recognize that your thoughts it's very hard to control your thoughts. It's very hard to control your emotions. You don't sit down and say, I think I'm now going to spend 5 minutes thinking about how difficult my life is. You don't. You actually just think instantaneously about how difficult this challenge is in your life. You don't prepare to think or feel about these things. Thoughts and feelings come thick and they come quick and they come uninvited. But behaviours and actions are controlled by us largely. So often I talk to people about the importance of focusing on what you can control and recognise, just before you focus on what you can control, recognise what you can't. And this helps people, particularly if they're in a state of anxiety. And COVID's a great example, but dealing with the diagnosis of a chronic health condition is a great example as well, because we don't have a lot of control over what's happening around us or about a diagnosis that cannot be cured as yet. So we need to check those thoughts and feelings we have about those things, and then we need to be able to launch into the behaviour and the action that allows us either time away from those uncomfortable thoughts and feelings, or allows us to move forward in a strategic way to make the situation better or more tolerable, or into a world of self-compassion where we can just have some time to work through the difficult thoughts, feelings, and the physical experiences that we might be having because of this disease.
Terrific. Thanks, Sal. I think it's easy for people who don't live with a condition like MS or NMOSD to say, just get on with it, be brave, take a risk. Do you have any advice in how to deal in situations where you are just not comfortable?
Around hearing those messages? Yes. I think there are two parts to this, and one of them might not be what everybody wants to hear. But I think, and so I'll start with that one, I think we really do have to keep an open mind. And I think we do have to be compassionate towards the people around us, as well as, so I should add the second point very quickly, as well as build our assertiveness skills. We need to do both. So I would like to think that the majority of people in our lives, yours and mine, Deb, but also in anybody listening today, I'd like to think that the majority of people in your lives have good intentions. They are there because of love, or they want to be supportive, they want to do the right thing. Sometimes they're missing the mark. But if we can see that their intentions might be good, even though, it's not coming across that way, we need to keep an open mind. We need to have some compassion for those people who honestly, they think they're being supportive, even though their words are like, a cheese grater to us. We need to be kind. But we also need to develop that assertiveness in being able to say no. I watched something on Netflix, it was a while ago, and it was about, I won't go into too much detail, but it was an interview and Jane Fonda was there. And Jane Fonda, who's, a wonderful feminist through the ages, has said one day, I think in her 50s or 60s, she realised that no was a complete sentence. And I thought, isn't that a game changer also for people with chronic health conditions, where you can say, please come. You only have to stay for half an hour. Please come to the social event. It's a barbecue in the park. It'll be full sun. It's 40 degrees. Why won't you come? You look so well. All of these people that try to encourage us to do things that they think would be good for us. And we can develop some good communication skills around saying no and being kind, but backing ourselves. So I think that communication is a big part of this. And I think that understanding that most people are trying to act with good intentions is also important, because we don't want to break ties with what could otherwise be great relationships just because this person is missing the mark. They might not have the knowledge they need to support us in a way that we need to be supported yet. But I like to think that most people are works in progress. So maybe we can help shape that for them.
I think that's some really good advice about learning how to say no, because often that's something that is quite difficult for many of us. And I learnt very quickly to say no and pace myself. And my friends that understood my disease after some time realised that, there's a reason why Debbie's saying no.
Yes.
And it's a bit of a skill learning to do it and to do it kindly.
Yeah, and,
So
and
that's some
actually,
good
Deb,
advice.
can I say that I'm also a big fan of thinking about this before it happens. So I guess that's why podcasts like this are so good, because you can start developing the skills before you put on the spot in the shopping centre when you bump into that friend and they want you to go to the, the next Christmas party, the fifth one that weekend or whatever it is. How do you say no? How do you get out of these things? So I think thinking about things before they happen is always a good strategy. Developing some key messages around how to say no is a good strategy. And you might want to, there are a million different options and no one size fits all, but it might be around, sometimes it's easy to shut other people down when you say something like, I understand and I really appreciate your support and your encouragement and your want for me to come to this barbecue, but I whether you say, I apologise or regretfully or however you want to say it, but you can say, I have to say no this time because that's the right decision for me. Now, adding that little bit at the end, because that's the right decision for me, is actually really difficult for other people to refute. Because you are telling them, I've made a decision, I'm telling you how I feel, and I'm saying it very clearly. So if you want to tell me that you have a better decision for me, give it a go. But it won't be easy for them to navigate a comeback to that, I think. But look, everybody has to figure out what works for them and what feels comfortable. But practice is a really important part of becoming more assertive in being able to manage your chronic health condition. Because if we look at that word, you want to manage it. You have to manage it. No one else is going to manage this for you. And part of being a manager is to be able to set boundaries and say no when you need to. So I would love for people to really feel more comfortable developing those assertiveness skills.
And I remember you in one of the conferences where you spoke and you talked about being the CEO of your own life, which is another topic altogether. But it really does make sense. You're the CEO of your health.
Yep.
And the people surrounding you, your support networks and everything.
Yes, absolutely.
So knowing that there is never a one-size-fits-all approach, what are your top 5 tips for managing uncertainty?
I love the top 5 tips. I've got 357 tips if you want them, Deb, but let's go with the top 5. Okay, so the first one is about self-compassion. I think this is a hard one for most human beings that I know to engage in authentically. Because I think we go, self-compassion, yes, got to be kind to myself. Yeah, I'll go and have a massage and, I'll have some me time. But we don't actually know much as a society about what self-compassion truly means. And I think the most important part of it, or the first step to it for people with chronic health conditions, is to remember that you are human. You're a human being. Remember this, you are one of, how many have we got, Deb? 5 billion? Is that right? Give or take a few. 5 billion human beings on this planet. And I think that this knowledge can be tremendously helpful in 2 ways. One, you're just a little speck. Now this, might sound a bit dark, but we're just little specks wandering the planet. Don't overthink your importance. It sounds so harsh, but don't overthink it. Everybody has challenges. Everybody has got stuff to deal with. And we have good days and we have bad days. We have to remember we are one of 5 billion. But we also have to remember that we are not any better than anybody else. And by that I mean, I see so many people who hold themselves up to these ridiculous expectations of what they can do when they would never hold up their loved ones to the same set of expectations. So I often talk to someone about, if I sense that they have unrealistic expectations going on in their life, often people will come and say to me, I was never sick. I've never been the person that was the sick person. And then I'm diagnosed with NMOSD. And I think, well, this doesn't fit with who I am. I'm not a sick person. How am I going to do this? And they refuse to kind of incorporate this idea into their mind so they can manage their chronic health condition. Instead, they use words like, I'm going to beat it, I'm not going to let it control me. And off they go, setting these unrealistic expectations given the diagnosis they have just received. If their best friend had received the diagnosis, They would be compassionate, they would be supportive, they would want their best friend to take some time to process this, they would want their best friend to learn a bit about it, be kind to themselves. But if they're the person being diagnosed, then all of the expectations for anybody else goes out the window, and they expect they can be better than anybody else in navigating this space. So I think self-compassion is a really important one. We need to remember that being diagnosed with NMO is a big deal. It's a big deal, and it warrants your emotions. You are allowed to have emotional response to this. It makes sense. This is a hard thing to go through. So allow yourself that. Allow yourself some time and allow yourself to feel all the stages of grief. Deb, we were talking about it before. You can feel sad and frustrated and angry and okay, and then sad again, and right round and round and round. So that's my tip number 1. Tip number 2. Now you asked for 5. You might be regretting that because I've got another one. Here's number 2, which is, it links back into that. It's about feeling all the feelings. It's about acknowledging and not pushing it down. So often I will see somebody who's been diagnosed with a condition like NMO, but I might see them 5 or 10 years down the track. And I might pretty quickly realise that in the first 5 or 10 years, they did not want anything to do with NMO. Now, nobody does, Deb. You and I know that. NMO, MS, nobody wants it. You wouldn't wish it on your worst enemy. So it's understandable that a lot of human beings say, I'm going to pretend it's not happening. I'm going to try and navigate a world and head in the sand. But 10 years down the track, for most people, you can't play the head in the sand game anymore. And those feelings are much harder to process if they haven't been processed in real time. When the doctor gives you that diagnosis, or in the follow-up appointment, you don't have to pretend you're fine in the 2-week follow-up appointment. You're allowed to sob in that neurologist's office or that health professional's office, even if they look a bit uncomfortable, because sometimes they can, and that's okay. You are allowed to have all the feelings. So I think that's the second one, is to feel all the feelings and be interested in your own feelings, which sounds a bit out there, but you're allowed to be interested in yourself. You're allowed to be interested that today is actually quite a good day. I wonder why I'm having a good day. I don't know. Isn't that interesting? Oh, well, maybe I'll leave that as a bit of evidence to not every day is awful. And maybe I just feel a little bit better today, and then tomorrow I'll be interested in how I feel tomorrow. And tomorrow might be awful, and you might go, well, that's not a surprise. But at least you can be interested that the next day might be something different. So I think sometimes...
And it's certainly worth... Oh, sorry,
No,
Sally.
go ahead.
It's certainly worth celebrating, isn't it, those good days?
Yes, it is. And it's worth celebrating like you would with a best friend. You're interested in your best friend's experience, so why aren't you interested in your own experience? And you can just monitor it and be interested and curious. It's one of the best human strengths, that curiosity in your own experience is something that you can really enjoy. This sounds weird, after a diagnosis like this, because nobody knows how they would react to this diagnosis. Nobody, because you don't know until you're in it. And why not be curious about your own reaction? Which leads into the next one, number 3, which is have a look at your coping strategies, Deb. Your coping strategies are different to mine, and they're different to the next person. We all have different coping strategies. So what I would love for people to do is to sit down and think, we all talk about coping strategies, but can we name our own? My coping strategies, the 2 big ones are, surprise, surprise, talking about it. You wouldn't get that from me, would you? Like, talking about things is really important to me, but also information seeking. Information seeking is important. I like to know what's going on. My symptoms, what the future symptoms could be, what this looks like. I like the stats to a point. I don't like it all day, every day, but I do like to have a solid knowledge of the disease. What I can expect is a difficult one, isn't it, Deb? Because who knows?
No one knows.
I like a pretty robust level of knowledge around a health condition if I'm the one with the health condition, but not everybody's like that. Some people want to go to the gym and get as fit as they possibly can so that they can say to the NMO, to the MS, to the other chronic health condition, bring it. I am getting ready to fight this as much as I can with my physical strength. Some people, Deb, like to engage in a coping strategy called wine drinking. Now as psychologists, we call that maladaptive coping strategies. But whether you're using the good coping strategies or the not so good coping strategies, it's important to recognize the ones that you're using. Because in those first few weeks of diagnosis, having a few extra wines is actually okay, but it's not a great long-term coping strategy. These are understandable coping strategies to have a bit of escapism, whether it's drinking wine or like binging everything on Netflix. Great escapism, not great long-term coping strategies. So that's my number 3rd tip, is to have a look. And sometimes you can say, what are the challenges I've been through in life before? And how did I get through it? What were the coping strategies I used then? And you might discover that actually talking about it, or not talking about it, but being amongst family and friends, you might rate that high on your coping strategies. So consider, how do I do that now? You might be in a different life situation. You might have different friends, different family members that you're in contact with now. So how can you convert good old tried and true coping strategies of the past to your current situation? Number 4, it's okay, this one doesn't go for as long. It's back to focusing on what you have control over. So we've already talked about it, but I think it's really important. I'm a huge fan. Deb, are you a fan of writing lists?
Oh, yes, I'm a list person.
Same.
I'm a list upon list.
Oh, lists upon lists. But making lists is great because it brings you very quickly into an awareness, a pen and paper awareness, or if you're on your phone, however you do your lists on an app, it brings your awareness to, do you actually have any control over that? I could write on a list, have a better financial situation, right? And that doesn't mean that I can go to Woolworths and buy that this afternoon and come back. It might mean that it needs to be transported to the longer term goal list that I've got, on the next desk over there. But it's certainly a way that you can sit down, put everything down on paper and figure out what are the little stresses I've got going on here that I have some control over. And then what's the action I need to take in order to minimize that stress. So focusing on what you have control over is a great first step in stress management, but it's also a really good way to stay in the moment, be mindful, and it's like one day at a time, one step at a time. And if you're having a bad day in terms of NMO, it's very important to just remind yourself, I don't have control over what I'm doing in February next year. I just have control over what I'm doing this afternoon. Just bring it right back. And then the last one, Deb, that I have, because it's hard to narrow it down to 5. You put me on the spot with 5. But the 5th one is to really work hard at building authentic, big word, genuine, they're the big words, relationships. Because we can all have lots of relationships, but the authentic, genuine relationships, the positive ones, they are the ones that will see us through this interesting journey with NMO. And they're the ones that we should actively maintain and look after. And they're always two-way streets, always. So we have a big responsibility to our future selves and to the people we love to put some time and effort into those relationships to make sure they stay strong if they're good for us.
So it's actually really a good opportunity, isn't it, Sally, to take control, but also it's an opportunity and chance to clean up your life a little bit too, including your friendships and the relationships around you.
Yep.
And as you say, it is a two-way street.
Yep.
I one of the things that I got out mostly from the times that I've spent with you is that taking control, concentrating on the things you can do, not the things you can't do, and cleaning up your life was something that I definitely did, and I'm actually really happy I did do it. So
there's a huge benefit, isn't there, Deb, to just take a moment to step outside yourself for a sec and have an objective look at what's going on. We're all human beings, we evolve, and our needs change and our circumstances change. And there's nothing like a diagnosis such as NMOSD, nothing like that to make us take stock of what we're doing, what other people around us are doing, and how we want to shape it. Because we can't shape it all. We don't have control over all of it. So it's that fine balance of saying, I don't have control over everything, but I've got control over a lot. and I can be strategic over not only the way forward, but how I think about it, how I'm going to apply myself to managing this situation.
Well, thank you so much for sharing your wisdom and experience with us today, Sally. I'm a big believer in concentrating on what you can do, not what you can't do, and looking forward. And I hope that any of you listening today have found something useful in, what we've shared in this episode. I could easily spend hours talking to you, Sally, about living well. So I'm hoping you can come back for another chat really soon.
I would love to come back, Deb. You know I would love to come back. Thank you for today.
We hope you have enjoyed listening to this NMOSD Your Way Global podcast. For more information about NMOSD and access to support and resources, please read the podcast description. What you have heard in this podcast may not be reflective of your own experience and does not replace the advice of a healthcare professional. If you have any concerns or specific questions about NMOSD, please speak to your physician.